Structure and functions of the lungs. The lungs are paired respiratory organs located in the thoracic cavity, playing a key role in the process of gas exchange. The primary functional elements of the lungs are tiny structures called alveoli, where oxygen and carbon dioxide are exchanged between inhaled air and blood. Normally, the lungs of an adult hold about 5.5 liters of air, but during quiet breathing, the volume of air involved in gas exchange is approximately 500 milliliters. Breathing process. Breathing involves two main processes: inhalation, inspiration, and exhalation, expiration. Inhalation. The diaphragm contracts. The ribs rise. The volume of the thoracic cavity increases, lung pressure drops, and air flows in. Exhalation. The diaphragm relaxes. The ribs lower. Lung pressure increases, facilitating the expulsion of air. Gas exchange. Gas exchange occurs in the alveoli. Oxygen from inhaled air penetrates the blood through the capillary walls, while carbon dioxide, produced as a result of metabolic processes, is expelled back into the lungs for exhalation. On average, an adult takes 14 to 18 breaths per minute. Lung anatomy. The lungs are divided into two parts. The right lung consists of 3 lobes, upper, middle, and lower, while the left lung has 2 lobes, upper and lower, due to the anatomical position of the heart. The lungs have a large surface area due to numerous alveoli, enabling efficient gas exchange. The total surface area of the alveoli is comparable to the size of a tennis court. Regulation of breathing. Breathing is regulated by the level of carbon dioxide in the blood. This process is controlled by the respiratory center in the brain, which responds to changes in blood composition, ensuring the restoration of normal oxygen and carbon dioxide levels. Bioresonance and lung functions. Modern diagnostic and therapeutic methods, such as bioresonance, open new opportunities for studying and maintaining lung functions. Bioresonance therapy is based on the principle of resonant interaction of electromagnetic waves with the cells and tissues of the body. Research shows that bioresonance can be beneficial for early detection of lung diseases such as pneumonia or bronchitis, reducing inflammatory processes in chronic conditions like asthma and COPD, enhancing regenerative processes and improving the overall adaptive capacity of the body. This method is actively studied for use in comprehensive therapy, especially in cases where traditional treatment methods are insufficiently effective. Major lung diseases. Chronic obstructive pulmonary disease, COPD. Characterized by progressive narrowing of the airways, leading to breathing difficulties and shortness of breath. The primary causes are smoking and exposure to harmful substances. Asthma. A chronic inflammatory disease causing bronchial narrowing and breathing difficulties. Asthma can be triggered by allergens, physical exertion, or environmental factors. Pneumonia. Inflammation of the lungs caused by infections, bacterial, viral, or fungal. Requires timely treatment. Emphysema. Destruction of alveoli, leading to reduced gas exchange efficiency. Often linked to smoking. Bronchitis. Inflammation of the bronchi, which can be acute or chronic. Chronic bronchitis is often part of COPD. Idiopathic pulmonary fibrosis. Scarring of lung tissue, disrupting its function. The disease has a progressive nature. Cystic fibrosis. A genetic disease causing thick mucus to form, leading to frequent infections and breathing difficulties. Lung cancer? A malignant tumor caused by uncontrolled cell growth. Key risk factors include smoking and exposure to carcinogens. Pulmonary embolism. Blockage of blood flow in the lungs by a blood clot. Symptoms include chest pain and shortness of breath. Pleurisy and pleural effusion. Inflammation of the lung linings or accumulation of fluid in the pleural cavity, causing chest pain and difficulty breathing. These conditions require an individual approach to diagnosis and treatment to improve patients' quality of life.